Heart health is essential to living a long and happy and full life. And today, I'm here with Keith Bishop, our clinical nutritionist, and we want to talk to you a little bit about heart health in this video. Well, we all care a lot about our hearts. They're pretty important that they keep working well, and our body actually does a pretty good job maintaining it and keeping it healthy as long as we treat it right and do what we're supposed to.
Right.
But let's be honest, the standard American diet and the standard American lifestyle do not lead to a super healthy heart. And there's essential minerals and vitamins that are often lacking, whether it's from our diet, from other sources that we could obtain these things like a supplement. So what are some of the basic nutrients that we need that really helps our heart thrive?
Okay, a few basic things include magnesium, which is a mineral. Magnesium is used for over 300 different processes in the body, including kind of relaxing the blood vessels, which it means they help opens them up. So it's one of those factors for blood pressure, help open up the blood vessel. So it helps the brain and the heart get more blood supply, function better. And one thing's kind of interesting is that product, we only get about half of what we need in our food.
Wow.
And then a couple other things that I think are critical, just based off of my experience over the last 20 years, is vitamin D3 and vitamin K2. Those products we can't really get very good in our foods, and we need much more than what we have thought we needed in the past. And but D3 and K2 help to pull the plaque off those blood vessel walls.
Okay.
And it's not immediate, but with some time, and that's going to improve the blood supply once again throughout the whole body.
Wow. So that's really interesting because we hear so much, you need vitamin D for your bone health, but you're telling me it also affects my heart.
Oh, exactly.
It's essential for so many things.
Wow.
Yes. So obviously you said we get potentially half of what we need from just our diet.
Yes.
So what are some ways these can be obtained besides our food sources?
Yeah. So basically supplementing. There actually is kind of a quality issue on how well they're absorbed. And so magnesium oxide, for example, is the worst absorbed. If it's not absorbed, you get diarrhea if it stays in the intestines. So that one takes a lot of stomach acid. Others are called amino acid chelates, including glycinate. So magnesium glycinate does not require much stomach acid to be absorbed. And so that's going to be very well absorbed. Matter of fact, vitamin D3 attaches to that and takes it into the body. So we got to have that on board, ready to go too. Yeah. And so the other item is supplementing. Well, most of us aren't outside enough to get our vitamin D3.
Right.
So we have to supplement with products for that. That's just a no-brainer.
Okay. So how do we know that we need these supplements in our body? So what are some maybe signs or what are some tests we can do?
Right.
What can we do?
Yeah, so there are some tests available, and there's a blood test for vitamin D3. Matter of fact, all practitioners now are doing this blood test, and that normal range goes from 30 to 100, and so my goal is to get everybody up to 65. So we use different lab companies for that and modify that, test again after 3 or 6 months.
Okay.
You don't know without doing a test on that one. Vitamin K2, there's not much of a test for it. There's a few practitioners are saying do a K test. There's actually K1, K2, K3. K1 and K2 are food sources, but that test is not a good standard yet. So we're just learning about it. And then magnesium. A lot of practitioners would do a magnesium level, but that tells us what is in the serum, not what's inside the cells. So that test is not very accurate. We have to go more along symptoms. So if a person has muscle twitches, it could be anything from a little eye twitch to muscle spasms and cramps are some signs that they need magnesium. High blood pressure. It's one of my favorite things to try to help relax those blood vessels quickly. Those are the most common signs. D3 and K2, no symptoms.
So along these lines, we kind of know what we need. What are some of your favorite supplements to maybe go along with this?
Well, we use a product called Vital Magnesium. Very well absorbed. It's that glycinate, magnesium glycinate. And then a product of D3K2, a combination, actually nice high doses of D3, and then higher than traditional doses of K2, but we're learning that it's actually very safe. I've done extensive research in the medical journals, I cannot find any concerns about toxicities with K2. So it's very safe, high doses. But it takes those high doses for both of those products to actually pull that calcium off. And then ladies, actually guys need to know this too, that calcium that we pull off, the K2 actually moves it into the bones and stimulates bone growth. Very interesting, amazing results.
Wow. So fantastic products, essential supplements to what you need for your daily life and your heart health. We have these available on our online store, or better yet, come talk to us today and let us see if these are the right products for you. It's just another example of how we help you feel better faster.